cardiac surgeon reveals the common medications that put seniors' hearts at risk. I've spent much of my life in the operating room repairing hearts. But what worries me most isn't just what happens inside the OR, it's what I see outside of it, hidden in plain sight, inside the very pills that so many people over 60 take every day. Every week I meet patients who believe they're only taking harmless drugs, painkillers, for arthritis pills, for acid reflux, or even simple cold remedies. But medical evidence tells a different story. Research from the FDA and leading cardiology journals has confirmed that these familiar medications can over time silently raise the risk of heart failure, dangerous arrhythmias, and even heart attacks. I'm not talking about rare or experimental treatments. I'm talking about everyday over-the-counter pain relievers, so-called stomach protectors, and basic decongestants. Both scientific studies and years of clinical experience point to a troubling reality. Many people over 60 are unknowingly adding more strain to a heart that is already aging and vulnerable. Our mission here is not to frighten you, but to help you gain clarity, equip yourself with knowledge, and ask the right questions so you can make safer, smarter decisions. In this video, I'll reveal the 5 common categories of medications that may be quietly harming seniors' hearts, and more importantly, the simple steps you can take right now to protect yourself. I'll explain why these medications can be dangerous, how they work in your body, and most importantly, what you can do to stay safe. Stay with me, because what you learn today could literally save your life or the life of someone you love. Section 1. The hidden danger in pain relief. Non-steroidal anti-inflammatory drugs, or NSAIDs. Let's begin with one of the most common groups of drugs found in nearly every home: NSAIDs. Names like ibuprofen, naproxen, or diclofenac are familiar to almost everyone. They're the pills we instinctively reach for when we have a headache, a stiff back, or aching joints. They are effective, no one denies that. But here's the part most people overlook: using them without caution, especially if you're over 60 or living with heart problems, is like playing Russian roulette with your health. Doctors have known for years that NSAIDs carry hidden risks. In 2005, the U.S. Food and Drug Administration (FDA) required black box warnings on these drugs about their link to heart attack and stroke. These warnings exist because the danger is real, not theoretical. Take the case of Eleanor, a 70-year-old retired teacher. She loved spending time reading to her grandchildren, but arthritis in her hips made even simple movements painful. To cope, she took ibuprofen almost every day. For a while, it seemed harmless. But one morning, Eleanor felt unusually tired, short of breath, and noticed her legs were swollen. At the hospital, doctors discovered she was in acute heart failure. Her heart, already stressed by age and mild hypertension, simply couldn't keep up. The trigger wasn't a new disease. It was her continuous use of an over-the-counter anti-inflammatory she thought was safe. So how can something so common become so dangerous? The mechanism is subtle. NSAIDs block enzymes called COX-1 and COX-2, which help reduce pain and inflammation. But those same enzymes also protect the kidneys and blood vessels. When blocked, 2 harmful effects follow. First, NSAIDs cause the body to retain salt and water. Think of your heart as a pump. If the pipes suddenly fill with more fluid, the pump has to work harder. A younger heart may handle the strain, but an aging heart, or one already managing high blood pressure, can quickly become overwhelmed. Second, NSAIDs constrict blood vessels and raise blood pressure. Even if you don't have hypertension, regular use can quietly push your numbers up. And if you're already taking medication for blood pressure, NSAIDs can blunt its effect, sending your pressure higher without you realizing it. This silent interaction dramatically increases the risk of heart attacks, strokes, and worsening heart failure. Medical studies consistently show that dose and duration matter most. High-dose ibuprofen, 200-400 mg per day, and diclofenac are especially linked to cardiovascular events. Low-dose naproxen appears somewhat safer, but the risk never disappears. To make things worse, if you're taking low-dose aspirin to protect your heart, ibuprofen can cancel out aspirin's protective benefit, leaving you exposed. So what should you do? The answer isn't to live in pain. The answer is to work with your doctor to find the safest path forward. Ask clearly, doctor, given my history, what's the safest option for me? For many people, acetaminophen provides adequate relief without the same heart risks. In other cases, topical gels or creams can deliver local relief with far fewer systemic effects. And when NSAIDs are absolutely necessary, follow the golden rule: use the lowest effective dose for the shortest possible time. By understanding how these everyday drugs affect your heart, you can make better choices. Pain relief should improve your life, not quietly endanger it. Now we come to the fourth category, and this one may surprise you. It's known as the stomach protector. I'm talking about proton pump inhibitors, or PPIs. Drugs like omeprazole, pantoprazole, and lansoprazole. These medications rank among the most widely prescribed and purchased in the world. Millions of people take them every morning, almost like brushing their teeth, either to calm reflux or to shield the stomach from other drugs such as NSAIDs. And yet here lies the irony. The very pill that promises to protect you from one danger may quietly be opening the door to another. Let me share the story of Harold, a 67-year-old retired accountant. Years ago, he was prescribed omeprazole for chronic reflux. His doctor advised him to keep taking it, perhaps indefinitely. The burning pain in his chest disappeared, and Harold never thought twice about it again. But nearly a decade later, during a routine checkup, his EKG showed irregularities that concerned his physician. A blood test uncovered the hidden culprit: his magnesium levels had dropped dangerously low. Magnesium is often called the guardian of the heart's rhythm. When it's missing, the heart becomes electrically unstable, like an orchestra suddenly playing without its conductor, and dangerous arrhythmias can emerge. For Harold, the cause was not a new disease, but years of uninterrupted PPI use. Here's the science behind it. PPIs work by reducing stomach acid, which makes sense for reflux. But that same stomach acid is essential for nutrient absorption. Suppress it for too long and magnesium uptake plummets. This isn't just a theory, it's a well-documented effect noted in medical literature. And the concern doesn't end there. Several observational studies, including research published in BMJ Open and Circulation, have found an association between long-term PPI use and an increased risk of heart attack. One hypothesis is that these drugs reduce levels of nitric oxide, a molecule vital for keeping blood vessels flexible and healthy. Without it, arteries stiffen, creating the perfect conditions for a cardiac event. While scientists still debate the causal link, the connection is troubling enough that cardiologists urge caution. PPIs can also interfere with critical medications. For example, omeprazole is known to blunt the effectiveness of clopidogrel, a blood thinner prescribed after a heart attack. This interaction leaves patients more vulnerable at the very moment they most need protection. PPIs were originally designed for short-term use, 4 to 8 weeks at most. Today, countless people use them as a permanent solution for reflux that in many cases could be better managed with dietary and lifestyle changes. So what should you do if you've been taking a PPI for months or even years? The answer is not to stop suddenly. That can trigger a rebound effect, worsening your symptoms. Instead, talk to your doctor. Ask specific questions. Do I really need this medication long-term? Could we lower the dose? Are there safer alternatives? And if chronic use is truly necessary, it is critical that your doctor monitors your magnesium levels regularly. A simple blood test could reveal a deficiency before it spirals into something far more dangerous. Before we move on to the next category, medications you might reach for during a simple cold, take a moment to reflect. Sometimes the very drugs we rely on the most are the ones that deserve the closest scrutiny. Section 3. The hidden danger in a simple cold: oral decongestants. By now, you've seen how common medications can sometimes carry risks we don't expect. Now let's move to the third category, one that nearly everyone has in their home medicine cabinet: oral decongestants. These are the pills that promise fast relief when you're battling a cold, especially those containing pseudoephedrine or phenylephrine. They seem like a miracle for that stubbornly blocked nose, but here's the truth. That quick fix can come with a price, and for your heart, that price may be dangerously high. Consider the case of Richard, a 74-year-old retired bus driver. After catching a severe cold, he picked up an over-the-counter cold remedy at his local pharmacy. By the second day of taking it, Richard began to feel like his heart was racing out of his chest. He grew dizzy, his head throbbed, and he was overwhelmed by a wave of exhaustion. Alarmed, his wife rushed him to the hospital. There, doctors discovered his blood pressure had spiked to a dangerous level, and he had developed an arrhythmia. The culprit wasn't the virus, it was the very medication he took for relief. So why does this happen? Pseudoephedrine and phenylephrine are classified as vasoconstrictors. Their main action is to shrink swollen blood vessels in the nasal passages, which reduces congestion and helps you breathe easier. On the surface, that sounds harmless, even helpful. But these drugs don't limit themselves to the nose. Once in your bloodstream, they constrict blood vessels throughout the body. This creates two major consequences. First, when arteries narrow, the heart must pump against a much higher resistance. The same thing happens inside your arteries, leading to sudden spikes in blood pressure that can be especially dangerous for older adults. Second, these medications act as stimulants. They increase your heart rate and can trigger irregular rhythms. For someone with a strong, healthy heart, this might only cause mild palpitations. But for a person over 60, or anyone already living with hypertension or cardiovascular disease, this extra stimulation can destabilize the heart, leading to arrhythmias, chest pain, or even hospitalization. In fact, European health agencies have recently revisited the safety of pseudoephedrine after studies linked it to rare but serious complications, including narrowing of blood vessels in the brain. While these events are uncommon, they underscore how powerful and widespread the effects of these drugs can be. The greatest danger is how ordinary these medications seem. Because they're sold over the counter, people often buy them casually, without ever reading the warning labels or considering the risks. But for seniors, the risk is real. If you're over 60, especially if you have high blood pressure, a history of heart disease, or are on heart medications, oral decongestants are best avoided. Thankfully, there are much safer options. Saline nasal sprays can clear congestion naturally by moisturizing and flushing the nasal passages. Humidifiers keep the airways from drying out, making it easier to breathe. And in certain cases, steroid-based nasal sprays prescribed by your doctor can provide effective relief without putting strain on your heart. So remember, relief for your nose should never come at the cost of your heart. What seems like a harmless cold remedy can, in reality, turn into a hidden danger. Protect yourself by choosing safer alternatives and by speaking with your healthcare provider before using any decongestant pills. We've now reached number 2, a delicate yet vital subject: mental health. This time we're looking at a class of older antidepressants that are still prescribed today, not only for depression, but also for chronic pain. They're called tricyclic antidepressants with familiar names like amitriptyline or imipramine. Depression itself is no small matter. In fact, research published in the Journal of the American College of Cardiology shows that depression can directly raise the risk of heart disease. That's why treating it is essential. But here's the catch: how we treat it matters just as much as the treatment itself. Let me introduce you to Margaret, a 76-year-old retired librarian. She lived with diabetic nerve pain that made even walking across her living room a struggle. Her doctor prescribed a low dose of amitriptyline. At first it worked. The pain eased and she felt some relief. But soon Margaret began noticing a troubling pattern. Each time she stood up, the room would spin and her legs felt unsteady. One afternoon, she fainted, falling hard and fracturing her wrist. At the hospital, the cause became clear. The medication had triggered orthostatic hypotension, a sudden dangerous drop in blood pressure upon standing. And that was only part of the problem. Tricyclic antidepressants can also speed up the resting heart rate, placing constant stress on an aging heart that has already worked for decades. Even more concerning, they can interfere with the heart's electrical system. On an electrocardiogram, this shows up as slowed conduction of impulses, which increases the risk of dangerous ventricular arrhythmias. These irregular rhythms are not just uncomfortable, they can, in the worst cases, lead to sudden cardiac death. Because of these risks, tricyclics are no longer considered first-line therapy for depression in older adults. Today, newer antidepressants such as selective serotonin reuptake inhibitors, SSRIs, are generally preferred since they have a better safety profile for the heart. Still, tricyclics remain in use, especially for neuropathic pain, where other treatments may fall short. If you or someone you love is taking one of these medications, it's critical to have an open conversation with your doctor. Ask the important questions. Have safer alternatives been considered? Are blood pressure and heart rhythm being monitored regularly? Mental and physical health are deeply intertwined. Treating one should never come at the cost of harming the other. We've now arrived at number 1. This is perhaps the most controversial and widely debated issue, but it's my responsibility to share a concern that many in the scientific community take seriously: calcium supplements. Yes, you heard that right. Those small tablets that millions of people swallow every day, believing they are protecting their bones from osteoporosis. For decades, the message was simple: take calcium, keep your bones strong. But in recent years, a growing body of research has begun to raise questions about whether these supplements might not be as safe for the heart as once believed. Take the story of Thomas, a 71-year-old retired engineer. Concerned about osteoporosis, he decided to start a high-dose calcium supplement on his own without medical guidance. For years, he never thought twice about it. Thomas suffered a heart attack. What puzzled his doctors was that he didn't have the usual risk factors. He didn't smoke. His blood pressure was well controlled, and his cholesterol was within normal limits. After reviewing his history, the team turned their attention to the supplement he had been taking every single day. This is where the controversy lies. The evidence is not entirely definitive, but the hypothesis is troubling. Calcium obtained from foods like dairy products, leafy greens, and other vegetables doesn't appear to pose a problem. It enters the bloodstream, gradually giving the body time to use it efficiently for bone health. The issue seems to arise when calcium is consumed in large concentrated doses through supplements. Here's the science. When you take a calcium pill, it creates a sudden spike of calcium in your blood. The body cannot channel all of it directly into the bones, so the excess must be deposited elsewhere. The main fear is that it settles into the artery walls. This process, called arterial calcification, makes the arteries stiff and less flexible, creating the conditions for plaque buildup that can lead to heart attacks. Several large studies have suggested that calcium supplements may modestly increase the risk of heart attack, while others have not found the same connection. The evidence remains complex. For individuals with diagnosed osteoporosis, the potential benefits of supplementation may still outweigh the risks. But the lesson is clear: when it comes to calcium, more is not necessarily better. The safest approach, supported by organizations such as the National Institutes of Health and the American Heart Association, is to prioritize dietary calcium. Foods like low-fat, dairy-fortified plant milks and green vegetables allow for slower absorption and better regulation by the body. If your doctor determines that you truly need a calcium supplement, never begin taking it on your own. This decision requires a careful balance, protecting bone strength while also safeguarding cardiovascular health. Today, we've uncovered the hidden risks behind 5 common medications: anti-inflammatories, stomach protectors, decongestants, older antidepressants, and calcium supplements. My goal is not to frighten you and certainly not to tell you to stop your medications on your own that could be dangerous. My message is empowerment. Now you know what? Many people don't. The arthritis pill that can strain your heart, the stomach protector that may disrupt its rhythm, the cold remedy that raises your blood pressure. Use this knowledge to become an active partner in your health. At your next doctor's visit, go prepared. Bring a list of every medication and supplement you take and ask, is this still the safest option for me? Are there alternatives? Should we be monitoring my blood pressure or lab results? Every treatment is a balance of risks and benefits, and that balance changes with age. Your heart has been working for decades. It deserves careful protection. Don't take any drug for granted, no matter how ordinary it seems. And finally, I invite you to share your experiences in the comments. Did anything here surprise you? Your story may help someone else. Always remember, the most important step you can take today to protect your heart tomorrow is simple talk to your doctor.